Good evening. My name is Carolyn Cook, and I will be presenting on behalf of myself, Tiyana Parks, Jennifer Rutkowski, and Joan Buck about how the Affordable Care Act has evolved since the 2016 presidential election and how these changes have impacted our healthcare system. We'll also explore how these changes have impacted people who were newly covered under the Act and examine the role of health insurance exchanges. It's an important topic because healthcare policy does not just impact insurance, it impacts people's ability to get treatment, manage chronic illness, and avoid medical debt, and live happy, healthy lives. The Affordable Care Act, signed into law by President Barack Obama in March 2010, was designed to provide all U.S. citizens and legal residents with access to affordable healthcare insurance, reduce costs, and improve quality of care. The components of the Act were intended to transform the system and make it more affordable and sustainable, with the central goal of expanding coverage through shared responsibility between government, individuals, and employers. One of the main components of this was the establishment of online marketplace exchanges, where individuals can shop health insurance plans, comparing costs, and applying for subsidies. States have the option of using the federal platform, healthcare.gov, setting up their own exchange, or creating a hybrid exchange. As of 2024, 19 states and Washington, D.C. have state-based marketplaces. 2 states use a hybrid platform, and the remaining use the federal marketplace. State choices are very important. California, for instance, maintains its own market called Covered California and invests significantly in community outreach initiatives. Conversely, states that are on a federal market, such as Texas, often have a greater percentage of uninsured people. Originally, Democratic states were the only ones to buy into the Affordable Care Act, but over the years, GOP-led states have found that the Act has expanded healthcare insurance coverage and that it's better than the insurance products they had prior. Plan premiums and out-of-pocket costs are also cheaper and appreciated. As stated earlier, the Affordable Care Act had a significant impact on the healthcare industry, including the expansion of Medicaid to the new adult group. The new adult group included those that qualified due to increased income eligibility levels and older children through the alignment of state-specific Medicaid eligibility for the Children's Health Insurance Program, or CHIP. The Act also mandated that states increase Medicaid coverage for adults under the age of 65, but this became optional in June of 2012 as part of the National Federation of Independent Business Supreme Court ruling. As of 2022, 3/4 of states have opted to expand. Further, the Act also streamlined the application process for Medicaid and subsidized coverage on the exchanges. States were also required to share eligibility information. Those enrolled as part of the new adult group were also part of the alternative benefit plan, which modeled commercial insurance rather than the typical Medicaid benefit. This plan provided states with the option of alternative benefits specifically tailored to meet the needs of certain population groups, target residents in certain areas of the state, or provide services through specific delivery systems instead of following the traditional Medicaid benefit plan. One key component that remained unchanged, though, was the continued requirement to include the 10 essential health benefits outlined in the Affordable Care Act. About 20 million individuals had access to health care by 2016 thanks to the expanded Medicaid eligibility and marketplace subsidies. Plus, the federal government put in place extra safeguards during the COVID-19 pandemic, such as ongoing Medicaid enrollment, to keep individuals covered throughout the outbreak. Therefore, even if individuals lost their employment or source of income, they would not lose their coverage. These Americans kept health insurance throughout the crisis thanks to this measure. The number of Americans without health insurance has fallen to all-time lows because of these safety nets, but there are still gaps, particularly in states that chose not to expand Medicaid. While the Act sought to broaden coverage and lower expenses, it has faced several challenges, including the rise in the cost of premiums due to the diminishing availability of services. This is partially due to a concept known as adverse selection. Those who anticipate having higher healthcare expenses, such as patients with chronic health conditions, are more likely to take advantage of the expanded health insurance, while those who anticipate lower expenses, such as young, healthy individuals, do not. If a risk pool includes only those with chronic health conditions, premiums can become very high, as a small percentage of the population accounts for a significant share of healthcare expenditures. In 2023, the average health insurance premium reached nearly $8,500 for individual coverage and $2,400 for family coverage, both reflecting a 7% increase for the year. Premiums again rose by 7% in 2024, and experts predict that this trend will continue with the same increase in 2025. This would be the fourth consecutive year of escalating costs. Following Obama's term as president, the Republican Party took control of the White House, and reform to the Affordable Care Act was a campaign promise that took front and center spot on the national political stage. Republicans long criticized the Affordable Care Act as government overreach, while Democrats defended it as a vital safety net. Both the implementation and attempted repeals were influenced by political control of the White House and Congress during President Trump's first term. Adoption was also impacted by state-level governance, as seen by the Medicaid expansion choices discussed earlier. Although access and costs surrounding healthcare has changed, analysts argue that the Act's cost-sharing provisions, such as deductibles and copays, can still create affordability barriers. Regrettably, the absence of affordable care places low-income households and families at a greater risk of experiencing health disparities due to limited access. Additionally, opponents argue that the Act has resulted in an increase in government expenditure, yet advocates counter that by focusing on primary and preventative treatments, uncompensated care costs may actually decrease and more costly levels of care, such as emergency and inpatient care, can be avoided. Regarding quality, the Act seeks to raise the standard of care through value-based programs like the Medicare Shared Savings Program and the Hospital Readmissions Reduction Program. Critics contend that quality improvements have not been uniform across the system, and underfunded hospitals still face challenges which limits the Act's ability to improve quality in neglected areas. And finally, there are vested interests of advocacy organizations, insurance companies, and providers. Because the Act's marketplace system offers a steady enrollment pool and predictable federal subsidies, many insurers embrace it. And because Medicaid expansion lowers uncompensated care, hospitals are in favor of it. On the other hand, conservative think tanks and small companies often want more market freedom and less regulation. All of these factors have created and changed the Affordable Care Act since the 2016 presidential election. The elimination of the individual mandate penalty was one of the most significant modifications. People were no longer taxed for not having health insurance as of 2019. Enrollment fell as a result, which led to adverse selection and an increase in premium costs, as previously reviewed. Additionally, the growth of short-term, limited-duration insurance plans altered the insurance market. Although these plans are usually less expensive, they provide far less coverage and do not adhere to ACA requirements. Moving forward, as they attempt to stabilize and enhance the healthcare system within the framework of the Affordable Care Act, state and national policymakers nevertheless confront a number of obstacles. Among the most important concerns is the Medicaid expansion gap. Millions of low-income individuals lack access to affordable coverage alternatives since 10 states have yet to extend Medicaid as of 2024. There is a disagreement among policymakers on how to encourage or force growth, especially in governments with conservative political ideologies. Stabilizing the individual insurance market presents another difficulty. Although the Act contributed to increased market competition, volatility has been brought about by the emergence of short-term plans and the removal of the individual mandate. While preserving consumer safeguards, policymakers must figure out how to guarantee a balanced risk pool. Disparities in health are still a big concern. Health outcomes and access to care remain lower for low-income and communities of color. These discrepancies were brought to light and made worse by the pandemic, and resolving them would need substantial change and investment. Lastly, partisan gridlock still impedes government advancement. The direction of healthcare policy is constantly changing due to changes in congressional power and presidential administrations, which causes uncertainty for both providers and consumers. Finding common ground and creating long-term solutions that enhance access, manage expenses, and maintain high standards of care are essential for long-term success. As you heard throughout the presentation, the passing and modifications to the Affordable Care Act have had both a positive and negative impact on Americans and our healthcare system. But overall, increasing access to appropriate care, managing chronic diseases, and allowing Americans to live longer, happier lives is a good thing when we embrace healthcare that prioritizes prevention and wellness and not just about treating illness and disease. We make forward progress. When we make our communities healthier through expanded coverage and population health initiatives, we have a healthier country. And when we lower costs to individuals, those individuals can then reinvest that money and save in ways to better themselves and our economy. While not perfect, the Affordable Care Act moved our country forward in creating a healthier, more vibrant life for its citizens. Thank you.